We will now proceed to Module 3 Skills Laboratory. First procedure would be suctioning. Suctioning is a method for removing excessive secretions from the airway. Suction may be applied to the oral, nasopharyngeal, or tracheal passages. In this procedure, we will be doing the tracheal suctioning. The purpose of this is to promote a patent airway by keeping it clear from excessive secretions. We have here materials for our suctioning. Suction source, connecting tube, sterile distilled water, sterile gloves, suction catheter with vent, sterile basin for trachea, tissues, and collector bottle. First procedure, gather equipment including extra catheters of the appropriate size. Connect collection bottle and tubing to vacuum source. Establish the need for suctioning by observing respiration and auscultating lungs. Wash hands thoroughly. You're now done washing your hands. Turn on suction to check system and regulate pressure if indicated. Fill basin with sterile water. Attach catheter to suction tubing. Use glove when handling a catheter. Place catheter tip in the basin and draw sterile distilled water through it. This checks the potency of the system, lubricates catheter, and flows some water in the collection bottle and will prevent aspirated secretions from suction. Occlude vent with thumb and slowly withdraw catheter. While rotating in between the thumb and finger, if catheter drops, remove thumb to stop suction. Dip catheter in and out of the basin, drawing sterile distilled water through it to clean it. Repeat steps 1 to 4 as necessary, and allowing 1 to 3 minutes in between suctioning periods unless there is an abundance of secretions makes this impossible. Prolonged suctioning can produce laryngospasm, profound bradycardia, and or cardiac arrhythmias from vagal stimulation and loss of oxygen. Turn off suction source, detach catheter from tubing and wrap tubing in sterile towel. Discard disposable catheter. Preferably, a new catheter is used each time suctioning is required. The connecting tube should be changed at the end of each day or shift or open if necessary. Make client comfortable and give mouth care. Assess effectiveness by observing respiration and auscultating the lungs. Respiration should be quiet and occurs without effort. Last is to record the following: the amount of color, and consistency of secretions. Whether the client is still coughing, is there cyanosis, frequency of suctioning, was there any bleeding, and response to suctioning. Empty and rinse collection bottle before it fills completely or at the end of your shift.